Hi, my name is Jenny. I'll be doing a video on a central line dressing change, or in this case, I'll be doing a video on a PICC line dressing change. I am outside of my patient's room. I'm looking at their MAR. I see my patient is Mary Smith, date of birth 5/18/1963. I'm looking at her allergies and I see that she has no allergies listed. I'm going to go ahead and gather my supplies, and I'm ready to come into the patient's room once I have everything gathered. Knock, knock. Curtain for privacy. I'm just going to wash my hands. Hello, Mary. My name is Jenny. I'll be your student nurse today. Can I have you please verify your full name and date of birth? And she tells me Mary Smith, date of birth 5/18/1963. That matches up. Mary, I am here today because I need to change the dressing on your PICC line. I do want to ask you if you have any allergies. She tells me that she does not have any allergies. I also kind of want to ask if she has any sensitivities, any cleansing solutions. So I do that, and she tells me no, she does not have any sensitivities, which is excellent. And since this is a PICC line dressing, I do want to make sure to measure it 6 inches above the insertion site. So I'm going to start out by doing that. So I go ahead and measure, and I will compare my measurement with the baseline measurement. I do this so I can assess in case there is an increase of half an inch. That might indicate that there is infiltration or phlebitis, or maybe the PICC line is dislodged and it didn't have any increase in measurement, so that's excellent. I also want to assess my patient at this time, make sure they're able to follow commands, because this is a sterile procedure, so I want to make sure they're able to kind of keep their hands away from the sterile field, and the patient is alert and oriented and able to follow commands. And Mary, I will need you to wear a mask if you're able to for this procedure, since it is sterile. She says that is okay. If the patient weren't able to wear a mask, I would have them turn their head away from the central line. So in this case, I'm going to prepare my sterile field. I'll open my kit. I'm going to grab the mask, and I'll place it on my patient. Put my mask on. I will apply clean gloves. And then I'm going to start removing the old dressing, which I will want to start from the outside edge and start peeling from the outside in towards the site of insertion. So I have the old dressing removed. I will assess any drainage. I'm going to assess for the color, the odor, consistency, and amount, which in this case there isn't any, which is excellent. I'll toss the old dressing, and then I'm going to assess the site of insertion, and I'm assessing for any redness, edema, ecchymosis, any drainage, and the approximation. It all looks excellent. Just going to remove this piece of tape down here. All right, Mary, I'm just going to go ahead and kind of palpate around your line here. Please let me know if you're experiencing any tenderness or pain when I'm palpating. Okay, and she does not report of any pain or tenderness. Excellent. Okay, I will remove my gloves, wash my hands. And I will reach for my sterile gloves. Noting that the outer 1-inch border is not considered sterile, so I will avoid touching it. Okay. Sterile gloves are on, and I am ready to cleanse. First, I'm going to clean with an alcohol swab or betadine or iodine. In this case, I have an alcohol swab. And to do this, I'm going to start from the center and work my way out in a circular fashion. Kind of cleanse around, cleanse around. And I'm doing this to remove any blood or old drainage. And I will toss that. Next, I will move on to my ChloraPrep or your facility's aseptic solution. So in this case, I would go ahead and activate my scrubber. Important thing with this is to remain a vigorous scrub to add friction for 30 seconds. And I'm going to start cleansing now. And do 2 to 3 centimeters around the insertion site. Really be adding some friction. Okay, let's say 30 seconds has passed. I will toss that. Okay, let's toss that. I'm going to go ahead and apply my skin prep. We'll toss that. And I just want to clean around my window. This is where the dressing is going to be applied. This just helps with adherence. I'll drop that in. At this point, I can remove my sterile gloves. And I will throw them in the trash, but I'll save mine for later. I'm going to wash my hands. This is a good opportunity to let everything dry. It's important to let it dry so that there's no moisture underneath the dressing. Okay, let's grab a new glove here. How are you doing, Mary? She says she's doing good. Everything feels okay so far. So then I will go ahead and reach for my dressing. And this is per facility. Some facilities have chlorhexidine. They have an embedded dressing or a bio patch. But in this case, I just have a transparent dressing. I'm also visualizing the catheter and hub and any attachment devices. I'm going to move this clamp out of the way. I will adhere my dressing. Sure that's nice and secured. I also pre-labeled a piece of tape with the date and time and my initials just to secure the tubing. I will place that on there. Okay, looks excellent. I'm going to remove my gloves. I'll wash my hands. I'm going to remove my mask. Remove the mask from the patient. And I will ensure that my patient is in a safe position, that her call light is within reach. She has all her belongings and knows to call for help if she is a fall risk. And I cleaned up all my supplies, threw them away, washed my hands. I would make sure to document the date and the time of the dressing change and any assessment findings. So any COCA or RITA, any drainage, the amount and descriptions, as well as any measurements if there's any deviation from the baseline measurement. And once I have that documented, I want to mention some lifespan variations. Say maybe you have an elderly patient who may be confused or unable to follow commands. You might want to bring in another nurse, an extra set of hands, just to kind of keep your sterile field free from any contaminants. And that concludes my video. Thank you.